Ken Barrett, Dan Bernal, George Blumenthal,
Here.
Maria Bonneville,
Present.
Linda Boxer, Anne Marie Duliege,
Yes.
Elena Flowers, Judy Gasson,
Here.
Viton Bassiani,
Here.
Pat Levitt,
Here.
Linda Malkus,
Here.
Adriana Padilla. And back to you, Judy.
Thank you, Claudette. Welcome everyone to the Governance Subcommittee meeting. We have an item on the agenda today that's going to be presented by JT. So take it away, JT. Thank you.
Thank you, Judy. And if I may, I'd like to start with a moment of silence for Fred Fisher, our cherished board member who passed away 2 days ago and whose funeral Vito and I just went to representing CIRM, and we will miss him dearly. I know we will have a number of comments at the board meeting during the chair's presentation, so we'll save that till then, but a moment of silence for Fred, please. Okay, thank you. On to the item, Madam Chair, Mr. Co-Chair, and members of the Governance Subcommittee. You will recall in this year of profound re-examination and change at CIRM that I reported that I would deliver a comprehensive reorg chart reflecting the needs, recommendations, and goals in our strategic allocation framework coming for consideration and formal approval by the board on September 26th, as well as in response to the performance audit recommendation that I reduce the number of direct reports to the president. That process I began in April with the promotion of Jen Lewis to Vice President of Operations in charge of grants management, IT, and finance. I, in consultation with senior leadership, have now completed our organizational review and present the results of that determination here for your consideration. Next slide, please. As background, this slide reflects the org chart as last revised in 2021. It specifies 8 direct reports and the referenced positions, which together in the aggregate comprise the bulk of the leadership team, or LT, that met weekly with the president. I should note that the LT was subsequently expanded, raising the total number in that body and of direct reports to the president to 11. This org chart was the subject matter of the current reorganization analysis. Next slide, please. The reorg process was driven, as noted, by the principles of the SAF as well as by the performance audit. That process was guided by a number of key goals derived from the SAF itself. These goals were as follows. Hold on 1 second here. Number 1, to enhance cross-departmental collaboration to create an integrated working environment across the agency. Number 2, to increase organizational productivity through such collaboration and streamline processes to effectively implement our strategic initiative. Number 3, to align functions with strategic priorities to again maximize collaboration in furtherance of our strategic mission. Number 4, to strengthen the data infrastructure to improve access to data generated by funded research, starting with the discovery part of the research continuum. And lastly, to support innovation to further CIRM's position as and previous practice of being very nimble to address any challenges and to embrace innovations in the field, much as we did when we responded in extremely short order in March of 2020 to the then blossoming COVID pandemic. Next slide, please. Reflective of these principles, I'm recommending the following key organizational changes. Number one, establishment of a position of Chief Science Officer. That's going to be Dr. Rosa Canetaviles. That being a centralized position to oversee all programs, discovery, preclinical, clinical, infrastructure, education, and patient access. Number two, you'll recall, before I name the position here, that we, in a previous session, a joint session of the Science Subcommittee and the Neuro Task Force, discussed the notion of consolidating the various preclinical grant categories into one and to forming a preclinical development group. So the second point here is the creation of that group, which will focus on accelerating therapies through early stage trials. That will be led by Dr. Shyam Patel, who is being promoted to the position of Associate Vice President. Number three, you'll recall that roughly 50% of our portfolio is devoted to rare disease, and that area has generated a great deal of interest as we have moved along with our reprioritization process. In reference and recognition of that, I'm forming a new position called Executive Science Strategic Officer for Rare Disease. That position will be the domain of Dr. Ablakrisi. That Executive Strategic Officer will strengthen our emphasis on rare disease through the development of a central rare disease pilot program. Number four, the establishment of research and development data infrastructure function. So here, as I referenced a bit earlier, one of the goals was to establish a group that will examine how best to collate, collect, and analyze data from our funded research to make sure that that data is accessible, interoperable, and reproducible going forward in accordance with SAF goals. And finally, I should say, by the way, that that new position is going to be the domain of Dr. Janie Byram. Finally, integration of clinical development and patient access. So all of the projects that are in the CLIN group that we have had over the years, many of those are now in trials in our alpha clinics, and the alpha clinics are part currently of the patient access team. So in order for the CLIN group and the alpha clinics to operate at peak efficiency, there needs to be direct collaboration and communication amongst those two teams in order to maximize the benefits of the alpha clinics to the projects that we are funding in the clinical development group. Next slide, please. So with all of this in mind, I give you this revised org chart. As you'll see, there are a number of points to note here, which I'd like to highlight. Number one, I have formed a streamlined executive team comprised of the heads of operations, which is Jen, legal, Raphael, review, Gil, and programs, Rosa. And as a result, we have a body that is considerably smaller than the leadership team, which is one of the directives of the performance audit. It will meet on a weekly basis and will be the body that will directly advise the president in all strategic matters of the agency. Point number two, operations and programs each have a number of direct reports, as you can see on the chart, which lead various operating teams. The operations will be grants management, IT and finance under Jen, and programs will be discovery and education, preclinical development, clinical development, patient access, and data under Rosa. Third, separate from the executive team, the heads of communication and HR, plus the executive strategy officer for rare disease, will report directly to the president as well. those positions will not be part of the body that forms the executive team that meets on a weekly basis. So when you take all of this in sum, I and our leadership team believe that this is an organization chart that will give us the best shot of implementing all of the goals of the strategic plan, which will hopefully be approved by the board later this month, and will position CIRM to maximize attaining its mission to bring therapies and cures to patients with unmet medical needs. So, Madam Chair, that's the slide deck. I'm happy to answer any questions.
Thank you, JT. One of the things that I appreciate about this reorg is that it rewards the great work that our senior leaders have done over the years, and it harmonizes what they've been doing with the future needs of the organization. So JT's happy to answer any questions. Maybe we'll leave the slide up while we take questions from the board, from the Governance Subcommittee. Well, there we go, Linda.
Oh, I'm sorry. I was going to echo what you said, Judy. I think it's wonderful, actually. I think it's a very good reorganization, and will make things more efficient and also break down silos, any potential silos. I think it's really going to work for the overall pipeline from discovery into the clinic and beyond. I think it's great.
Thank you, Linda.
Pat, please.
Yeah, JT, she talked about your leadership council. You meet weekly. What's the plan for meeting with HR and communications, which are reporting directly to you but are not part of that group? What's your plan in terms of the meeting?
Yes, so I have regular. Sorry, Pat, didn't mean to interrupt. Sorry.
No, go ahead.
Yeah, no, I have regular one-on-ones with communications with Corinne, and plus a number of ad hoc discussions that come up as events warrant. With respect to HR, in similar constant communication with Denise as issues arise that require my input and discussion. And we've been, in the course of putting this org chart together, obviously HR has been a big part of the discussions on how to come to the various positions and conclusions that we put up here. So we a very robust relationship with both.
Okay, it's an opportunity also for your leadership council to bring issues around communications and HR to you that then can be discussed with those two entities. I think that's important because there's always adaptations that occur both in communications and HR based on the activities that are going on and the progress that's being made. So I too, you've heard this before, really appreciate the organization. It's also aligned with the recommendations that we had from the audit to really organize this in a cogent way that made it very clear about oversight and about your role as president and CEO. That's good.
Thank you.
Other questions or comments from members of the subcommittee? Well, JT, it looks like you were your usual extremely clear self in explaining this. We are not able to, because of quorum, we're not able to vote on a motion to recommend approval to the full board, but I would like to be able to give the full board a consensus of this meeting. Yes, Vito.
Hi, Judy. Thank you. Okay, this is really, I hope it's not superfluous, but I've been following the development of this, I'm going to guess now for 4 months at least, with JT. I'm so impressed with how elegant it looks through its simplicity. I think, as Pat said, it satisfies, more than satisfies the requirements of the performance audit. But I think at the board meeting on September 26th, this is going to follow on the agenda immediately on the heels of his presentation and Rosa's presentation on the strategic allocation framework. And I think it's going to be both more powerful and more obvious that this is a great support for that reorganization. And it should get, I love it. I think it's going to get support across the board. Congratulations, John. JT, this is great.
Thank you, Vito. And that goes to all the members of our executive team and leadership team before that. I should note, by the way, Pat, we had our inaugural meeting of the executive team this week. And as one might assume, given the wide range of issues, it was a full 2.5 hours that, among other things, caused me to be late to my lunch with Maria and got me in hot water.
True. It is true.
But it was a very informative session with lots of great discussion on a number of topics of note. So we're off and running, perhaps a bit on the assumption that the org chart will be approved by the board. We thought we'd get going because we have a lot of stuff to deal with, as particularly we head into what we hope to be the implementation of an approved strategic allocation framework later this month.
I would strongly recommend, given my own experience with my leadership group. I meet weekly with them as well. The meeting is never less than 2 hours, never. So
Yes.
Schedule accordingly, unless of course you're going to a Dodger game.
I'm glad you brought that up, Pat. But I'll refrain from saying anything further. I don't want to be accused of dwelling on the standard topic, but thank you for mentioning it.
No problem.
I'm not seeing any raised hands, nor am I hearing any dissent from any members of the subcommittee. Is there any public comment, Claudette?
There are no hands raised.
There are no hands raised. Okay, so great job, JT and team. I agree with all the wonderful things that have been said and the importance of breaking down silos and barriers and working together in this very harmonious strategy. Scott, do we have other agenda items for today?
We do not. This is it, Judy.
Well, thanks to the very efficient presentation and the great work of the leadership group. Unless anybody has any other matter that they would like to bring up at this time, I believe we will go ahead, adjourn the meeting, and give everybody a half hour back. Any comments, questions, issues that anybody wants to raise? Okay, seeing none, thank you all very much, and look forward to seeing you at the board meeting in San Diego in a couple weeks.